Natalie and Monique. Monique Middlecoff, Natalie Hodson. Okay, next question. If I had my babies 10 years ago, is this program going to still be beneficial for me, or did I screw up by doing these high impact exercises for 10 years?
That's a great question, and I like to think about this just like any other muscle group. So let's say you had someone who hasn't exercised for 10 years. Would exercise be beneficial in that category? The answer, so many yeses to that. Like yes, 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 and yes. Because I think there's a lot of women who have never done a pelvic floor strengthening exercise in their entire life.
Yeah.
And the more that we activate the tissue and we make those patterns between the nervous system, that's like the communication center that controls the movement, and the muscles that actually provide the action, we help ourselves prevent issues down the road. We help strengthen the tissues that we have now and improve any issues that we had in the past.
And I'll just say from my own personal experience, I didn't do any of these exercises until Phoenix was almost 3 years old. And then once I started through it, it tremendously improved everything. In fact, I don't have issues with accidental leaks anymore. So I can just speak on my own experience that happens true as well. Okay, so we have been getting quite a few questions from people who have been diagnosed with some form of prolapse. And so they want to know, is this program going to be helpful and beneficial? And first, I just want to touch on and say thank you so much to those of you who have reached out to us, and we have gotten so many messages from people saying, I had this for years and was embarrassed to talk about it, and I am so grateful that you guys are talking about this, because it's a sensitive topic by nature. So why don't we kind of explain what prolapse is? And I don't know if we even have some pictures we can show.
I know. Maybe I can link in the comments section a really good place to get some visuals. But so prolapse, there's multiple types of prolapse. So one of the most common types is called an anterior wall prolapse, where if you were to think about the vagina as a whole, the front side of it, which just means more towards the front of our body, the front side is where we have the bladder. So if the bladder kind of scooches down, and we're talking about tissues sort of sliding down or scooching out of their original intended location, and when that happens, there's a lot of symptoms that we can see that kind of give us an indication that that's happening. So things like having a difficulty going to the bathroom and getting a full empty bladder oftentimes happens because the urethra gets pinched when those tissues slide down. There's some good visuals, so I hope you go look at them. But it helps to provide an understanding of what's happening. So sometimes when we think prolapse, we think, oh, things are just, sliding and falling out. And that would be kind of one of those older belief systems about, oh, when women exercise, your uterus is going to fall out, which we know doesn't happen.
But there's different stages. There's stage 1, 2, and 3.
Absolutely. And most of the time, the classification is about the descent. So there's a lot of ways you can test for it. One of the most clinically significant ways is to have a gynecologist or a urogynecologist. They have women in the table. They ask them to press down like a Valsalva maneuver. What does that do? Raise intra-abdominal pressure. Hoorah. And it pushes the tissue down. And so it's a measurement, and that's how we know the scale of stage 1, 2, or 3.
So sometimes people would describe it as like feeling like a grape. It was even like pushing out of your vagina, or things like that.
A bulge, vaginal heaviness, extra pressure. Those would be things that you would feel that you might not see any tissue on the outside.
And so from a visual perspective, as you strengthen your pelvic floor, that can help, am I saying this correctly? So it can help with the prolapse, because as your pelvic floor gets stronger, it can help bring everything back into its intended position.
Yes. Now, where we don't see as beneficial results is once we've gotten to a stage 3. That would be, so if we had this as the outside of the body, this would be in the inside, this would be on the outside. As we see tissues descend significantly outside the body in a stage 3, that there's not a lot of evidence to support pelvic floor strengthening as reversing a stage 3 prolapse. So that's another time to see a provider.
Yes, definitely.
Okay, a different type of prolapse is posterior wall prolapse. So that would be rectal prolapse, where we see the vagina sort of scooching down and things moving forward instead of moving backward. It's a different type. And also for those who've had a hysterectomy, it's actually really common to have prolapse where we have sort of the vagina folding in on itself, because where the uterus was sitting, that whole space has now been open, where other tissue above slide down, and now we have things that are experiencing more pressure than they did before. So it's one of the more common types of prolapse.
So you guys, these are really sensitive topics and things that could be embarrassing to talk about, and so that's why we want to talk about them, because there's so many people who have reached out to us and they're like, oh my gosh, I thought I was alone in this. I had so much shame surrounding it. So we just want to talk about it, let you guys know there's no embarrassing questions here in our private support group. Nothing's off the table. It's a safe space to ask questions and have support.